Welcome back, everyone, to a brand new video. My name is Dr. Raghav Sharma. I'm a graduating physical medicine rehabilitation resident. If you're new here, welcome. If you're returning, welcome back. I hope you enjoy this video. The last several videos I've made are kind of a reintroduction to myself. If you have been following, then you knew I made YouTube videos kind of in undergrad as well as in med school, and then kind of fell off when residency got busy, and now I'm back. And the last couple of videos, like I said, have been kind of a get to know me, know what I've been doing in the past, as well as what I'm going to be doing in the future. And this is the last video in that series, and it's more so of what I want to do in the future and what my ideal practice looks like as a sports and spine physician. And if you want to stay tuned to all of this, and make sure you're subscribed, and if you want to catch up to the last couple of videos, then make sure you click them over here and also subscribe so that you don't miss any new videos. Hit that notification bell, all that kind of stuff, just so that you can continue following along my journey. But without any further ado, let's get into it. Before we get into what my practice looks like, it's important to understand kind of what services I'll be able to provide to my patients and kind of what services I'll be able to provide to the community. And a lot of this is based off of videos that I've made recently. So if you have not already, check those out right here. But I'm going to be a sports and spine physician, so be able to offer comprehensive musculoskeletal care. So I guess skill set based off that is number one, being able to offer comprehensive musculoskeletal examinations. And this is like hands-on patients, do physical exam maneuvers and figure out what's going on, because physical exam is really important, and you can figure a lot from history and physical exam about what a diagnosis is going to be before we even do any of this fancy imaging or further testing. So that is kind of a cornerstone, and that's what physiatrists are really, really good at. So that's number one. Number two is, if needed, perform electrodiagnostic procedures. This is nerve conduction studies and electromyography to really hone in on neuromuscular diagnoses and diagnoses of the peripheral nerves. And that really only if needed to really hone in on diagnosis before the patients go on to whatever the next treatment may be, if it's something I can offer or if it's something that I would have to refer out to someone else. Number three is perform basic musculoskeletal procedures, and this is kind of injections into a variety of joints within the arms, legs, kind of collarbones, all these different areas. And building off of that is also ultrasound-guided musculoskeletal procedures. And this is something that I might have to work a little bit harder at, because this is something that's not necessarily baked into my fellowship as far as the very advanced ultrasound stuff. Yes, every physiatrist can do a lot of ultrasound-guided procedures, but mostly it's just the bread and butter, and not some of those more innovative techniques out there that you might get at some more advanced sports fellowship. So I'll probably end up doing some sort of course for this, or taking weekend courses, just really honing in other ways outside of fellowship. But then that's kind of the fourth thing. And then after that is the bread and butter of what I would probably be doing and what I'm going to be doing my fellowship in, which is interventional spine procedures. And this is anywhere from, once again, the high cervical spine down to the sacrum and kind of the bottom of the tailbone area. And also those large joints, sometimes if needed, can be done fluoroscopically as well. So that's kind of what I'll be able to do as far as hands-on. And then after that, there's obviously prescribed medications to help patients with musculoskeletal pain if they have that ongoing, or any other musculoskeletal relevant medications. And then after that is also my expertise of resistance training, and that is going to be able to help patients in offering them a resistance training program. Nothing too intensive, because that takes a lot of time, and it's done better by other professionals who are continuing to do that. But be able to offer and answer questions on a lot of the basics, and be able to offer something as a starting point due to my expertise as a former certified strength and conditioning specialist. Now that we've talked a little bit about the what I can offer, let's talk about the why, or essentially my practice philosophy. And a lot of it comes down to four things. And the first thing is always to make sure that I am true to my mission, which is helping make sure that patients are getting back to doing what they want to do, and helping patients move so that hopefully they can live more fulfilling and happier lives. This has been at the foundation of the reason that I'm in medicine, at the kind of foundation of everything. And if you have not heard this, then you haven't watched any of these videos over here, so go watch those. But that's kind of the core basis of it all. Number two is to make sure that patients have a good experience. And for some reason in medicine, it's evolved in the way that patients are not at the center of the experience. Medicine, or the intervention, or whatever it is, happens to be at the center, and both the physician and the patient are kind of on opposite ends of that. And it shouldn't be that case by any means. It should always be the patient who's having a good experience and the patient who's at the center of the experience, whether it's at the front desk, whether it's talking to a physician in physical exam or the actual procedure, whatever it is, the patient should always have a good experience. And part of that comes into number 3, which is in shared decision making. And for whatever reason, also in medicine, it's come down to and evolved to really a lot of times the physician is the one who's kind of telling the patient about what's going to happen, what the next treatment is, and the like. And I really want to make sure that we engage in shared decision making. So I'm asking the patient, what do you care about? What are your goals? How can I help you? Here's what I can offer, but what do you want to do with everything that's on the table? And I think this lends itself to patients really understanding what's going on with their care and then ultimately leading to better care for that patient. And then number 4 is to equip patients to handle life themselves. And this is really coming down to more of the preventive medicine aspect of things. And I'm not going to make a big kind of explanation of this in this video. I'm not going to harp on it because that'll spoil my entire next video. So if you want to learn more about those 5 tenets of preventive medicine, then make sure you're subscribed and watch the next video because I'm going to talk a lot more in that. But the biggest thing is to equip patients so that they can deal with life themselves and that they are practicing preventive medicine and making sure that they're maximizing their own life outside of my clinic because they can't live in a clinic, they can't live in a hospital. So really maximizing preventive medicine is the best way, and I want to help patients do that. And now, where does this all take place? What's the physical location? And once again, this depends on if I am self-employed, if I own my own practice, or if I'm working for someone else. And this is going to be an ideal. But kind of the basics for those who are not like understanding or have never been to a musculoskeletal clinic, pretty much most clinics are set up the same way. And that's the physical location, the practical location, which is a front desk. And then there's a back area. There's several examination rooms for patients. And then there's also typically procedure rooms. And in the setting of a procedure suite that does fluoroscopic injections, then there would be that. So they'd have one floor room, maybe multiple floor rooms if there's multiple providers or practitioners there. So it's not slowing things down. And then also a procedure room for ultrasound guided procedures. And that's so that you don't have to keep lugging around an ultrasound into different rooms. It'd be nice just to have everything in one area so that you can get it taken care of and really maximize efficiency. I want a place that really maximizes efficiency because it comes down to a lot of things. And number 1, it helps the patients because there's not a lot of waiting. There's not a lot of kind of lugging things around. And in lugging things around, you miss things, you forget things, misplace things. You don't want that to happen. And then also it helps a physician in terms of efficiency of being able to see more patients and also in making sure that we're able to provide better care by not missing things. And then after that, after kind of the basic practical stuff of clinic is also a gym. I would love to have a gym with my practice. And this doesn't mean it's going to be like a Lifetime Fitness with a sauna, a pool, all that kind of stuff. This is really just the bare bones and the basics of what you would need in a gym. And that includes things like a squat rack, some dumbbells, kettlebells, things like that. Just very basic so that it provides enough equipment to be able to provide a good resistance training routine. And this is number 1, selfish for myself so that I can have something to work out at and make it extremely convenient, either before work or after work. And then also have some place for my patients to also work out. And whether this is as part of a guided group class or whether it's working out with myself, I can show them things during even maybe a clinic visit. It would just be extremely convenient because I think the basis of a lot of things is exercise and helping patients get back to exercise so they can build their own robustness and their own resilience within their own life. So having a gym would be like, it would be unimaginable to have in a practice. It would be something that I can only dream of right now, but hopefully I can make it a reality. So the next thing now is kind of who do I want to work with? And once again, a lot of this depends on whether I am running my own practice or whether I'm employed by someone else. But this is just an ideal of who I'd like to have around me to be able to offer the best care that I think I can offer to the community and to patients. And number 1 is myself as a comprehensive musculoskeletal and spine physiatrist, interventional physiatrist, whatever you want to call it, to be able to help patients with whatever musculoskeletal issues they have as they come in the door. And then after that, I'd love to have someone else like myself, an interventional physiatrist, that can offer kind of complementary services to myself. I might be really good at some things and not so good at others, and the other physiatrist might be much better at those other things and not so good at what I'm strong at. So hopefully we can have some sort of dynamic where we can cover each other's strengths and weaknesses to be able to offer great comprehensive care. After that, I'd love to have another physician that does primary care, and this is because a lot of musculoskeletal complaints are often kind of compounded by health issues that are more medical in nature, such as hypertension, hyperlipidemia, diabetes, and a variety of other medical things that also lend itself to preventive medicine. So having someone there who is much more trained in these things, as far as either family physician or an internal medicine physician, would be a huge benefit to the practice. And I'd love to have someone like that in close proximity and working with myself. And then after that would be a physical therapist. And physical therapists are amazing at helping patients kind of regain their confidence and regain an entry point into some sort of movement and exercise after an acute injury. So that'd be a tremendous resource to have within the clinic itself. And then after kind of building patients back up to continuing on, then it would be either potentially handing them off to a personal trainer or someone of the like. And yes, I said personal trainer, and you might not hear that very much in traditional medicine because they're kind of quote unquote not deemed medical for some reason. But I think that there'd be a tremendous asset to any sort of practice, especially if there's a gym within the practice or somewhere nearby to help patients really continue on that resistance training and exercise program in general, so that they can continue to build like robust resilience, for lack of a better term, to whatever else comes and really practice preventive medicine. So how does this all look when it comes down to practice, and what does the week to week look like? And this is kind of the nitty gritty of kind of a clinical practice. And obviously I don't know, it depends a lot on whether or not, once again, if I'm employed by someone or if I employ myself, as in I run my own practice. But this is what a typical week would look like. And this is two parts. One's a clinical and one's a non-clinical. And as far as the clinical part goes, there's really a couple things. It's not really complicated. The first is having half days for seeing new patients and for seeing follow-up patients, just to see how my patients are doing, either after procedure or continuing in follow-up. And then there's half days for electrodiagnostic time, and this is to perform electrodiagnostic exams so that I can get good diagnoses on patients before they go on to either whatever the next treatment may be. And then there's half days for fluoroscopic guided procedures, and this is for procedures from the axial spine, kind of anywhere from the cervical spine down to the lower back and sacrum area. And then also half days for ultrasound guided procedures or just general procedures that need to be done that are not fluoroscopic guided. That's kind of the bare bones of the clinic time and how a week would be set up. And then after that, there's some like admin time that you might put in there for non-clinical work. But most importantly, what I want to make sure that I can also do in my practice is set aside time for community service. And this is either before the practice starts, I guess, before the day starts or after the day, and sometimes even on the weekends. And like I talked about, I'd love to have a gym in my future practice. And a big part of this is either before or after work, having just open time where my patients can come and work out with me. I'd love to have a gym there so that I can work out. And if someone wants to come and work out with me, sure, I'd be more than happy to. It'd be great to just kind of lift with your doctor. A pretty interesting concept, right? And then after that, I'd love to have that space as well so that I could host community events, and mostly so that I could train the community in resistance training and host free courses, free classes for people who want to come, group fitness classes, all those different kinds of things, because it really builds on that tenet of community service, as well as helping the community develop their own kind of fitness and their own kind of preventive measures by resistance training and learning healthy habits. So that's kind of how the weekly setup would look like. Obviously, there's a lot of unknowns, but that's what I would like as an ideal. If you have made it this far into the video, then first off, if you've not subscribed already, then why are you still here? I'm assuming you're interested in what I'm saying because you made it to the end, so you should subscribe right here. But all jokes aside, thank you so much for watching. I hope you found some sort of value in this, and I hope you follow along for the rest of the journey. Once again, thanks for watching, and I'll see you in the next one.